Hey guys, so today we're going to be talking about controversial treatments for mental illness. Originally this video was going to be called How We Used to Treat Mental Illness, but a few of the things that I'm talking about today are current or have been recently used, and so it's not really how we used to because one of these things is actually in the works right now. I do want to give you guys a warning that a few of the things I'm going to be talking about today is very shocking and disturbing, and so if you're sensitive or easily, I don't know, upset, then probably not the video for you because I will be using imagery from these experiments and possibly videos. So I'm just giving you guys a warning now instead of before each experiment, I'm so used to saying that. Before each treatment, instead of giving a warning then, I'm just giving you an overall warning now. Everything in this video is pretty sensitive and disturbing. So the first one we're going to be talking about today is electroshock therapy. This is a very commonly known one. It's very popular. A few of these things you've probably already heard of. Hopefully I can give you guys some more information on it, however, or if you've never heard of them, here you go. So electroshock therapy is when a couple nodes are placed in your head and they produce electric currents throughout your brain, and this actually causes a seizure and it can change your brain's chemistry. So it was a very effective treatment for mental illness, specifically severe depression, severe mania, and catatonia. This is obviously controversial because of the method. Going under a seizure on purpose can be very damaging emotionally. However, this is still used today. Yes, this is still an effective treatment for mental illnesses today, specifically for those who do not react to other treatments such as psychotherapy or medication. Used in very extreme circumstances, and today they actually use general anesthetics, so you are not conscious when this is all happening, and because of the anesthesia and the muscle relaxant, it's actually not apparent that you're having a seizure. It's all happening just in your brain. You are not physically moving, so it's not as violent as it used to be or what you've seen in the movies and things like that. Now, when this was first invented, anesthesia was not given, so you were conscious when you are going through a seizure, and your body was going through convulsions because they did not have the same muscle relaxants that we do today. Some people prefer this method to taking medication, so you are able to have this done if you prefer it, with, you know, obviously doctor permission and going through the psychotherapy and things like that. But also the most disturbing thing about this is that they use this on pregnant women because pregnant women cannot take medications for mental illness or it could harm the fetus. So some pregnant women will go under electroshock therapy for their treatment. A few of the side effects, they're actually not that severe. One of them being confusion. You may not remember who you are, ranging from a few minutes afterwards to a couple hours. Usually doesn't go beyond that. In severe cases it can. There's memory loss, usually about events that happened either right before the treatment or, like, you know, a little bit before, weeks before, but that usually comes back over time. And of course there's possible heart problems involved because you are under anesthesia, which can be, you know, dangerous in itself. So, and obviously with the treatment your heart rate goes up, so you could have possible heart problems from this, but that's also very rare. So yeah, most of these side effects are not serious and they clear up pretty much within a few weeks after the treatment. However, this is a temporary treatment for mental illness. You do have to go through multiple sessions of electroshock therapy, and yeah, I guess the reward is worth the risk. Next one we're going to be talking about is lobotomies. This one might get a little disturbing, just FYI. I mean, the other one was too, but this one also. This was used for many mental illnesses, including depression, schizophrenia, and even chronic pain like back pain. And it was used all the way into the 1980s. Which, that's really recent. However, this actually started outside of the US. When we think of ice pick lobotomies, that was not the first lobotomy ever given. Outside of the US, they did other surgeries such as drilling holes into the head and things like that. So the concept was already created before it came to America. Of course, this became a little bit more mainstream in the 1940s when Walter Freeman wanted to create a method that didn't involve surgery. So his belief was an overload of emotions led to mental illness. So if you sever those nerve connections in the brain, it can lead to stabilizing your personality. Thus, he created the 10-minute transorbital lobotomy, otherwise known as the ice pick lobotomy. Basically, what he would do is make the person unconscious. I can't say unconscious. Unconscious? Why is that such a difficult word? Anyway, he would make them, he would put them under by electroshock therapy. He would then take an ice pick, or they're called ice picks, but it was actually a surgical tool about this long of a pick. The reason why it's called ice pick is because he originally used an ice pick. But he would take one of those and insert it into the eye socket. Now our eye socket is completely enclosed by our skull, but the bone in the back of our eye is actually very thin, so he could break through that, get to the nerves of the frontal lobe of the brain, wiggle it around a little. He had like a specific motion. It wasn't just kind of like, you know, doing all this. He would move it back and forth, sever those connections, and then move on to the other eye. He himself performed over 2,500, but I think it was like 40,000 in total were given in the time frame of when this was allowed. One time he performed 25 lobotomies in one day, and to shock his audience, he would put in both at the same time to show how talented he was. So one of his youngest patients was 12 years old, and he was actually interviewed in 2006 at the age of 56, and he said, "If you saw me, you'd never know I had a lobotomy. The only thing you notice is that I'm very tall, weigh about 350 pounds, but I've always felt different, wondered if something's missing from my soul. I have no memory of the operation and never had the courage to ask my family about it." So Freeman had to stop giving lobotomies eventually, and they kind of went out of date because when he was giving his third lobotomy to one woman, she had 3, she actually had a brain hemorrhage and died while he was doing that. Some people and the families of some of the patients said this was actually very good for them because at the time, it's obviously very shocking to us now, but at the time, this was the best thing that they had. Not a lot of new medications were being invented, and because of the stigma of mental illness, the treatment was horrible for it, and so this was very revolutionary at the time, and a lot of people said, you know, it worked for what it did what it was supposed to do for the time being until we came about better science and better treatments for mental illness. So the next one is called surgical bacteriology, and this was done by Dr. Cotton. I just have it written down as Dr. Cotton surgery. So this guy was from New Jersey, and he saw when people had super high fevers, they would hallucinate. He believed that it was illnesses and bacteria and viruses, things like that, that was causing mental illness because you're hallucinating, right? This was all happening in 1906, so keep that in mind. We did not have the education that we do about the brain, so the process of going through what we've all been through in science is amazing to me, how far we have come. So in 1906, he started his surgeries. He would see if a certain body part was maybe causing this illness or the behavioral problems, and he would then remove said body part. He started small with teeth. He began pulling the patient's teeth. He would take out, if that didn't work, he would then move on to the tonsils, and if that didn't work, he began becoming a little bit more extreme with his surgeries. He would remove testicles, ovaries, gallbladders, spleens, stomachs, and even whole sections of patients' intestines. So because he was claiming an 85% success rate, even though patients were dying because, oh, can I mention he wasn't a trained surgeon? People at the hospital, families, and patients themselves began to question his methods a little bit because he wasn't going into it with critical thinking or scrutinizing his work. He wasn't looking at the results from an unbiased perspective. He was like, no, I'm right, this is working. And so because of that, during the investigation, he had a nervous breakdown and pulled out his own teeth. He also claimed that it worked. He obviously stopped performing these surgeries, and 3 years later he had a heart attack and passed away. So the next one is insulin shock therapy. This is kind of similar to electroshock therapy, but induced by insulin, obviously. That's why it's called that. So there was a Polish neurophysiologist named Manfred Sackel. I think I'm pronouncing that right. And he accidentally injected too much insulin in a patient, and they had convulsions, and he saw it as an effective treatment for treating psychosis, especially schizophrenia, which there wasn't much treatment for this at the time. He would often not only give them an overdose of insulin, but induce comas as well, and 70% of his patients actually saw improvements of their mental illness symptoms, which blows my mind. Also, how did he accidentally overdose someone on insulin? So the treatment was very temporary, much like electroshock therapy. You would have to do multiple sessions of this, and it was actually used in other countries until very recently, but it was still used, like in this century. It was seen as the gentler method of the somatic techniques as opposed to something like electroshock therapy. All right, the last one is groundbreaking. I'm telling you, this is brand new stuff coming into the psychology world. This is something that has not been discovered in the past. past. Maybe it has, but we just don't have record of it. And this one is very interesting to me and very intriguing, and I'm very interested to see what happens with the government and how this all turns out. So the last treatment we're going to talk about for mental illness is hallucinogenic mushrooms. Now, I'm not an advocate for drugs or drug use or anything like that. I'm just giving you the facts. You can form your own opinion. I'm not saying that this is something I'm going to try out. I'm just saying this is something that has been proven through studies that could possibly work for severe mental illnesses. So there was a recent study done where they studied cancer patients with anxiety and depression, and they wanted to see if the drug psilocybin, I think that's how you pronounce it, which is the main psychoactive ingredient in magic mushrooms. They wanted to see how this affects the brains of these patients. The results were actually extremely effective, and researchers compared it to an equivalent of surgical techniques. Just one dose of this psilocybin alleviated the symptoms of many mental illnesses, and the patients who went through this said it was one of the most meaningful experiences of their lives and reestablished their importance in the world. Now, how they've kind of explained this is when you're on a trip, this is not coming from experience, I've never done mushrooms, probably never will. I'm just saying, this is scientific, guys. When you're on a trip, people have said that they see sounds, hear colors, things like that. And it's this cross-wiring that they're using to explain why this would be effective on a depressed mind. So the drug actually changes how the brain receives and sends information. And this is why it can be an effective treatment for those who have anxiety or depression or addiction, is because it kind of breaks that chain of thinking and the pattern of thinking that you're constantly in, just cycling all the time. It kind of breaks that and it opens up new pathways in the brain for new connections to be made, and so it can actually change your brain chemistry, sometimes permanently. In fact, the effects of the drug, not the trip part, but the effects, the positive effects of helping the mental illness can last for months, sometimes years. They're also studying the effects of LSD, and they concluded that this LSD and magic mushrooms are an effective treatment for severe mental illnesses, and especially for those who are resistant to other treatments. So that is it for the controversial treatments of mental illness. Let me know some more down below if you've heard of new ones. I could also do part 2, 3, and 4 of this one as well if you want me to continue this as a segment on my channel too. Let me know your thoughts down below. I hope you enjoyed, and I'll talk to you soon.